Aviane is a combination hormone medication used to prevent pregnancy. It contains two hormones, a progestin and an estrogen. In addition to preventing pregnancy, it can also make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. It's important to note that using this medication does not protect you or your partner against sexually transmitted diseases such as HIV, gonorrhea, and chlamydia. The recommended dosage is 1 pill daily, and it's best to take it at the same time each day to ensure effectiveness. Before you start taking Aviane, make sure to read the patient information leaflet provided by your pharmacist. It contains important information on when to take your pills and what to do if you miss a dose. Take this medication by mouth as directed by your doctor, usually once daily at the same time each day. If you are taking the chewable tablet, follow the manufacturer's directions for your brand. It's crucial to continue taking this medication exactly as prescribed by your doctor. Make sure to take it at the same time each day, 24 hours apart. If you experience vomiting or diarrhea, you may need to use a backup birth control method. It's also recommended to take this medication after your evening meal or at bedtime to help with stomach upset or nausea. Your pill pack contains 21 pills with active medication and may also contain 7 reminder pills with no medication. Take one active pill once daily for 21 days in a row. If you are using a product with 28 tablets, take an inactive pill once daily for 7 days in a row after you have taken the last active pill unless otherwise directed by your doctor. If you are using a product with 21 tablets, do not take any tablets for 7 days unless otherwise directed by your doctor. For the first cycle of use, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you are switching from other forms of hormonal birth control, consult your doctor or pharmacist for guidance on how to make the switch. Possible side effects of Aviane may include nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these effects persist or worsen, it's important to speak with your doctor or pharmacist. It's essential to remember that the benefits of taking this medication outweigh the potential risks of side effects. Many people who use Aviane do not experience serious side effects. However, it's important to monitor your blood pressure regularly and notify your doctor if it becomes elevated. Seek immediate medical attention if you experience any serious side effects, such as lumps in the breast, new or worsening depression, severe abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing of the skin or eyes. Additionally, Aviane may rarely cause serious problems from blood clots, so it's important to seek medical help if you experience symptoms such as chest pain, sudden dizziness, trouble speaking, or vision changes. While allergic reactions to this medication are rare, it's crucial to seek immediate medical help if you notice any signs of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects not mentioned, it's important to contact your doctor or pharmacist. If you are in the US, you can report any side effects to the FDA. In Canada, you can report side effects to Health Canada. If you are over 35 years old and smoke cigarettes, do not use Aviane. Smoking while taking Aviane can increase your risk of stroke, heart attack, blood clots, and high blood pressure. The risk of these serious problems increases with age and the number of cigarettes you smoke. It is important to not smoke or use tobacco while using Aviane. Before using Aviane, it's important to talk to your doctor or pharmacist about any allergies you may have to estrogens or progestins, as well as any medical history you may have related to blood clots, high blood pressure, cancer, diabetes, heart problems, liver or kidney disease, and other conditions. If you have diabetes, you should regularly check your blood sugar levels and inform your doctor of any changes. Aviane may also contain sugar and/or aspartame, so it's important to be cautious if you have diabetes or phenylketonuria. If you are planning to have surgery or will be confined to a bed or chair for an extended period of time, it's important to discuss this with your doctor, as it may affect your use of Aviane. This medication may cause dark areas on your face and skin when exposed to sunlight, so it's important to limit sun exposure and use sunscreen. It may also cause vision problems or difficulty wearing contact lenses, so it's important to contact your eye doctor if these issues arise. It may take longer to become pregnant after stopping the use of Aviane, and it should not be used during pregnancy. If you become pregnant while taking Aviane, you should inform your doctor immediately. Additionally, it may decrease breast milk production, so it's important to consult your doctor before breastfeeding. Drug interactions can affect how well your medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Aviane include certain medications used to treat chronic hepatitis C, hormonal birth control, drugs used to treat seizures, and HIV drugs, among others. It's important to tell your doctor when you start any new drug and discuss if you should use additional reliable birth control. Also, be sure to inform your doctor if you experience any new spotting or breakthrough bleeding, as these may be signs that your birth control is not working well. It's also important to note that Aviane may interfere with certain lab tests, so be sure to inform lab personnel and all your doctors that you are using this medication. If you or someone else has taken too much Aviane and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to seek immediate medical help by calling emergency services or a poison control center. In the U.S., you can call the local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of an overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's important not to share Aviane with others. Make sure to have regular physical exams, including lab tests, while taking Aviane. This may include checking your blood pressure, doing a breast exam, pelvic exam, and pap smear. Follow your doctor's instructions for examining your breasts, and report any lumps right away. It's crucial to keep all medical and lab appointments. If you have any questions, consult your doctor for more details. If you miss a dose of Aviane, refer to the product package information for advice. It's important to use backup birth control, like condoms or spermicide, to prevent pregnancy. If you have trouble remembering to take your pills, talk to your doctor about switching to a different form of birth control. When storing Aviane, it is important to keep it at room temperature, away from light and moisture. Make sure to store it in a safe place that is out of reach for children and pets. Do not flush Aviane down the toilet or pour it into a drain unless instructed to do so. It is important to properly discard this product and it is expired or no longer needed. If you are unsure about how to dispose of Aviane, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.